Okay, Melissa, thanks for coming in today.
Yeah.
We had some lab testing, and I've reviewed your entire history. We've gone over that before, but I wanted to let you know what we found and what I can do to help you to make your health optimal as possible.
Great.
So what we found is that a lot of your lab values are not optimal or low. And so versus going to a regular doctor who would just give you medications and then you'd be done with it, this is a whole lot more comprehensive approach. So let me explain this to you.
Okay.
First of all, the most important thing that you have to know is that you have autoimmune disease. That you thought that you just had run-of-the-mill low thyroid, and what happened was we checked some antibodies, and so your body is actually attacking itself.
Mm-hmm.
Now, because of that, that's a whole lot more comprehensive program we have to do, because what we have to do now is we have to completely get your immune system under control, and that starts in your gut. Okay? So we have to really work on your gut health and evaluate your digestive system in a much more comprehensive fashion. And we have to get your hormones balanced. We have to detoxify your body and get rid of all the toxins that are in your system that are contributing to your health. And then educate you on the best way to be healthy from a lifestyle perspective moving forward. So whereas the typical physician who would look at these labs would say, oh, let's just put her on this medication, what I'd like to do is set you up an entire program for optimal health, because you have an autoimmune condition, not a thyroid condition. Mm. And so there's going to be some further testing to be done, and then there's going to be a stepwise approach to being able to get this under control that's going to take about 6 months.
So is this something that my current endocrinologist, I mean, why haven't they found this, and would they do the same thing with me?
No. So typically in traditional medicine, we don't look for antibodies to the thyroid because it wouldn't change the way we treat your thyroid, mm-hmm. Especially when we're talking about Hashimoto's, which is what you have.
Okay.
Now that we're going to give you a copy of your labs, you can send this to them, but their approach is going to be the same. My approach is going to be different because we know, using the principles of functional medicine, getting the root cause of a problem, that we can actually prevent or reverse any more damage to your thyroid, which is ongoing right now. Mm. And we can potentially help to reverse it and it definitely make you feel optimal in terms of your symptoms. So right now, you're having symptoms of low energy, low level depression, swelling, and you really feel like you haven't been able to lose weight no matter what you do. I feel like with our comprehensive program, we're going to be able to make you start to feel better very quickly, and then start to fix all these things at the cellular level, at the inside of your cells that you don't even know where is going on, so that we can help make everything healthy again.
So you're going to be able to stop the process of, if I'm understanding, you're saying that I have an autoimmune, so my body is attacking it, my thyroid is attacking itself. But through this process, that this is going to help to stop that?
Yes, ma'am.
And do I need to take medications for that?
There may be medications we have to take, and there may be supplements we have to take, right? So right now you're on a thyroid medication that we may change. We also may put you on a medication called low-dose naltrexone, which reduces the autoimmune reaction in your body. We're going to check your stress levels using cortisol and using a saliva test, and then there may be supplements to use for that. There may be further testing we're going to do, which I usually do for people, to evaluate your gut health. So that, because a lot of times the things that may be causing your autoimmune condition may be a bacteria or a parasite that's in your intestines that you don't even know is there. Hmm. So the little bit of irritable bowel that you talked to me about before, that you felt like was just intermittent, that could be a sign that there's a bug in your intestines that's causing all of this.
Well, do I need to just take an antibiotic?
Well, we need to check the lab test first, and then we could use an antibiotic, but I found that if we take an antibiotic, we get rid of all the bacteria, not just the bad ones. If we use a natural supplement, it's more gentle, and we're able to get things under control the same way, but in a way that doesn't kill off all the good bacteria, which are very important to you moving forward for your health.
Okay, all right. And so, I mean, I've been on medication now for a couple of years, and you're saying that we can work on this in, did you say 6 months?
Mm-hmm. Typically 6 months.
Wow. I don't know why my doctor hasn't told me that. Well, this sounds great. Yeah. So what's our next steps?
So our next step is we'll sit down and we'll talk to you about what the investment would be for the program. And if you feel like that's something you'd like to move forward with, then we'll move forward. We'll give you your lab testing today,
Great.
and we'll schedule you for a follow-up in about 2 weeks to review the other lab testing.
Amazing. Thank you.
You're welcome.